What were the key highlights in MPN at ASH 2021? Indeed, we had several interesting information for those diseases. In particular, some data that help us to be more confident in drugs that we already used, such as fedratinib, for example. There were presented the results of the FREEDOM and FREEDOM2 studies that shows that indeed appropriately used, this drug, for example, with thiamine supplementation and a quite strong symptomatic prevention of its GI toxicity, lead to a safe utilization, allowing the patients to enjoy the benefits of this JAK inhibitor that is now approved in the US and also in Europe. We also had information about drugs that we hear about for several years already that are tested in phase 2 and now phase 3 trials, such as pelabresib, for example. This drug is used in the MANIFEST studies as first or second line therapy for patients with MF, and also either in monotherapy or in combination with ruxolitinib. And indeed, we have now strong data suggesting that this drug, in addition to the clinical benefits in terms of reduction of spleen volume and symptoms improvement, may also reduce the JAK2 allele burden in some patients and also provide improvements in the degree of bone marrow fibrosis. So to be continued, the story of pelabresib is not finished, but we already have some interesting data. We also had information on a bunch of new drugs that target alternative pathways other than JAK inhibition or BET inhibition, such as, for example, bomedemstat, which is an LSD1 inhibitor tested in myelofibrosis, but also in other MPNs, such as ET or PV, and also tagraxofusp, which is a drug targeting CD123 that is also interesting. Probably these drugs will not be first-line therapies for our patients, but maybe an interesting option in the future for the treatment that have failed or are not tolerated by our patients. We also have interesting information with rusfertide, nepsidine agonist, that seems to provide interesting benefits in terms of reduction of the need for phlebotomy in patients with polycythemia vera, and in particular, improving also their quality of life by reducing the iron deficiency that patients experience with long-term phlebotomy. So this is also an alternative treatment that may be useful for PV patients in the future, and the phase 3 study is about to start with this new drug. We also have an interesting information with AVID200, which is a drug inhibiting TGF-beta pathway, and we know that TGF-beta is a key player in the field of myelofibrosis, promoting fibrosis in the bone marrow. Interesting data presented by John Mascarenhas included the improvement in thrombocytopenia for patients receiving these drugs. So we know that this is a terrible need because we don't have efficient therapies for patients with myelofibrosis and severe thrombocytopenia besides pacritinib. And this could be another alternative pathway allowing patients with severe thrombocytopenia to receive safe and efficient treatment. Lastly, we also had a presentation by Dr. Jason Gottlieb of the results of pemigatinib, drug targeting FGFR1 in mixed lineage neoplasms, including 8p11 anomalies or rearrangement of FGFR1. You know that these diseases that are often complicated to diagnose because they mix sometimes lymphoid and myeloid proliferations, have also a very poor prognosis if the patients cannot benefit from a bone marrow transplantation. Indeed, the results of the FIGHT study using pemigatinib provided for the moment really impressive results in terms of responses in those patients that usually do not respond to standard therapy, and in particular allowed a lot of patients to bridge to transplantation and hopefully be cured of these terrible diseases. There's another drug, futibatinib, also an FGFR inhibitor that is tested. So we have maybe these new options for those treatments with mixed myeloid lymphoid proliferations. Thank you very much.